Welcome to our channel. Today we're going to delve into a crucial and often overlooked topic, the odors that our body can emit and that could be early signs of cancer. Detecting the disease in its early stages significantly increases the chances of successful treatment and can literally save lives. Therefore, we ask you to stay with us until the end of this video, where we will reveal 8 odors related to different types of cancer that many people ignore. If you find this information valuable, please leave us a comment with the number 1. If you think we can improve, the number 0 will help us offer you even more relevant content in the future. Now, without further ado, let's begin this important journey. 1. The moldy smell, an early alert for mouth and throat cancer. Mouth and throat cancer represents a serious threat to health, and its early detection can be a challenge. However, our body sometimes gives us subtle clues, and one of the most surprising is a peculiar odor that may resemble mold, persistent humidity, or even wood in the process of decomposition. This stench is not a coincidence. It arises from a complex biological process that is triggered with the development of cancerous cells. Dryness in the mouth, a symptom sometimes associated with oral cancer, can alter the balance of the bacterial flora, favoring the proliferation of microorganisms that contribute to this odor. In addition, as the tumor grows, it can cause necrosis, the death of the surrounding tissue. This decomposition releases volatile organic compounds, chemical substances that evaporate easily and that are responsible for the characteristic odor. Imagine the cancerous cells as a focus of alteration in the microenvironment of the mouth or throat. Their metabolism differs from healthy cells, and in this process they release byproducts that add to the compounds generated by necrosis. As the disease progresses, the concentration of these substances increases, making the odor more perceptible. It is important to note that this odor is not always evident to the affected person, as olfactory adaptation can make one get used to it. However, people nearby, when speaking or approaching, may notice it in the breath. The danger lies in the fact that this odor is often mistakenly attributed to poor oral hygiene or pre-existing dental problems, such as advanced cavities or gum infections. This confusion can lead to a significant delay in seeking specialized medical attention, losing valuable time for timely diagnosis and treatment. It is crucial to understand that the smell of mold or rotten wood rarely appears in isolation. It is generally accompanied by other signs that should alert us. A persistent hoarseness that does not improve over time, difficulty or pain when swallowing, dysphagia. The appearance of wounds in the mouth or throat that do not heal despite care, the presence of white leukoplakia or red erythroplakia spots on the oral mucosa, and unexplained ear pain that may be a reflection of the problem in the throat. If you or someone you know experiences this unusual odor along with any of these symptoms, the recommendation is unequivocal. Seek the opinion of a specialist. An otolaryngologist or an oncologist can perform a thorough evaluation. Examinations such as biopsy, where a tissue sample is taken for microscopic analysis, along with imaging studies such as computed tomography, CT, or magnetic resonance imaging, MRI, are fundamental tools to identify the underlying cause of these symptoms and the odor. Early detection is key to improving the prognosis in cases of mouth and throat cancer. 2. The smell of decomposition, a warning sign for colorectal cancer. Colorectal cancer is among the leading causes of cancer mortality globally. Often, its first manifestations are subtle and can be confused with benign gastrointestinal ailments. However, paying attention to changes in our habits and the signals our body emits can make a substantial difference. One of these signs, perhaps not very intuitive, is an alteration in the odor of feces. In cases of colorectal cancer, feces may acquire an unusually strong, penetrating odor that evokes the decomposition of organic matter. This olfactory change is due to the way the tumor interacts with the digestive process. Cancer can alter the intestinal flora, favoring the growth of anaerobic bacteria that produce sulfurous gases and other malodorous compounds. In addition, the presence of the tumor can hinder the complete digestion of food, which leads to the release of toxins and waste products that modify the natural odor of feces. In some cases, there may be bleeding, although not always visible to the naked eye, and the decomposition of this blood also contributes to the fetid odor. It is important to differentiate the normal variations in the odor of feces, which may occur due to changes in diet or the intake of certain medications, from a persistent and unexplained odor of decomposition. If this olfactory characteristic becomes a constant and is not related to obvious factors, it should trigger an alarm. This change in odor may be accompanied by other symptoms that deserve medical attention. The presence of blood in the feces, which may be bright red or dark, almost black, persistent abdominal pain or frequent cramps, significant alterations in bowel habits such as diarrhea or constipation that does not subside, or a feeling of incomplete evacuation, and unexplained weight loss. The particular danger of colorectal cancer lies in the fact that many of its symptoms, including modifications in the odor of feces, tend to manifest in more advanced stages of the disease. Therefore, noticing an alteration in the odor may be one of the few early clues available before the problem worsens and spreads. Faced with the persistence of an odor of decomposition in the feces, the recommendation is clear: do not delay consultation with a doctor. Examinations such as colonoscopy, which allows visualization of the interior of the colon and rectum, stool analysis to detect occult blood or alterations in the microbiota, and imaging tests such as computed tomography or magnetic resonance imaging of the abdomen and pelvis are essential tools for the diagnosis and staging of colorectal cancer. Early detection significantly improves survival rates. 3. The sweetness that scares, the odor of breast cancer. Breast cancer is one of the most prevalent neoplasms worldwide among women, and although it is less common, it can also affect men. While most awareness focuses on the detection of nodules or changes in the shape of the breast, there are other lesser-known signs that could indicate the presence of the disease, especially in more advanced stages. One of them is the appearance of a sweet and paradoxically unpleasant odor that can emanate from the skin or from wounds associated with the tumor. This characteristic odor is observed more frequently in cases where breast cancer has progressed and may have caused secondary infections or necrosis of the tissues in the affected area. The uncontrolled growth of cancerous cells can generate local inflammation and compromise the immune system, facilitating the proliferation of bacteria. These infections, along with the decomposition of tumor tissue, necrosis, release a variety of chemical compounds, some of which may have a sweetish odor. Open wounds or ulcers that may form in the breast in advanced cases are the most common sources of this odor. Initially, this sweet odor could be confused with signs of a simple skin infection, or even attributed to inadequate personal hygiene. However, its persistence, especially if accompanied by other warning signs, should be a cause for concern and a thorough medical evaluation. In addition to the odor, breast cancer usually manifests with other better-known symptoms, such as the palpation of a nodule or thickening in the breast or armpit, changes in the texture or color of the skin, orange peel, redness, abnormal secretions from the nipple, especially if they are bloody or unilateral, or persistent pain in the mammary region that is not related to the menstrual cycle. Any combination of these symptoms, and particularly if it is associated with the appearance of a sweet and unpleasant odor, requires immediate medical attention. The main challenge in the fight against breast cancer is that many people, especially in the early stages, may ignore subtle symptoms or attribute them to benign conditions. This negligence can lead to a delay in diagnosis, decreasing the chances of successful treatment. It is essential to remember that breast cancer has high cure rates when detected in its early stages. Therefore, paying attention to all the signals that our body sends us, including this unusual sweet odor, can be crucial to saving lives. If you or someone close to you notices unusual changes in the odor of the skin or the presence of wounds in the mammary region, do not hesitate to seek medical help without delay. Regular breast self-examination and mammograms, according to medical recommendations, are essential tools for early detection. 4. The smell of sulfur in the breath, a clue to stomach cancer. Gastric cancer is an insidious disease that often presents with vague and non-specific symptoms in its early stages, which makes early detection difficult. However, in some cases, a notable sign may manifest in the breath, an odor that resembles sulfur or rotten eggs. This stench, although uncommon, can be an important clue about what is happening inside the stomach. The appearance of this odor is related to the alteration of the digestive process caused by the presence of the tumor in the stomach. Cancer can interfere with the normal production of gastric acid and digestive enzymes, which leads to incomplete digestion of food. This poor digestion can result in the fermentation of food in the stomach and the release of sulfurous gases, which are responsible for the characteristic sulfurous odor. In addition, in some cases, there may be bleeding inside the stomach, and the decomposition of the blood can also contribute to a fetid breath. It is important to note that bad breath related to gastric cancer tends to be persistent and does not disappear with usual oral hygiene measures or dietary changes. While an occasional sulfurous breath may be due to certain foods or minor gastrointestinal problems such as acid reflux or gastritis, its persistence without a clear cause should be a cause for concern. In addition to the odor in the breath, gastric cancer can manifest with other symptoms that reinforce the need to seek medical attention. These include persistent abdominal pain or discomfort, a feeling of early satiety, feeling full after eating only a small amount of food, loss of appetite, unexplained weight loss, frequent nausea or vomiting, and difficulty swallowing, dysphagia. If you perceive this persistent odor in your breath, especially if it is accompanied by any of the other symptoms mentioned, it is essential that you seek the opinion of a doctor. Early diagnosis of gastric cancer is crucial to increase the chances of successful treatment and a higher survival rate. If you notice persistent changes in your breath or experience other worrying digestive signs, the recommendation is to consult a gastroenterologist for a thorough evaluation. Diagnostic tests may include an upper endoscopy, gastroscopy, where a flexible camera is inserted through the esophagus to visualize the interior of the stomach, as well as biopsies to analyze any suspicious tissue, and imaging studies such as computed tomography. Remember that gastric cancer, when diagnosed in its early stages, offers better treatment options and a greater probability of cure. Do not ignore the signals your body sends you. 5. The horror of the smell of rotten meat. Alert for skin cancer. Skin cancer, and particularly melanoma, is one of the most aggressive and dangerous types of cancer. Although early detection, through the control of moles and suspicious spots, is fundamental, there are other lesser-known signs that may indicate its presence, especially in more advanced stages. Surprisingly, one of these signs may be a characteristic odor. People with advanced skin cancer especially those with ulcerated tumors or with metastasis, may report the perception of an unpleasant odor similar to that of decomposing meat or rotting organic matter. This stench is the result of a complex biological process in which cancerous cells, when growing uncontrollably, may exceed the supply of blood and nutrients, which leads to necrosis or cell death. The decomposition of these tumor cells releases a variety of volatile chemical compounds, many of which have a fetid and characteristic odor. This smell of rotten meat may emanate from open wounds or lesions on the skin that do not heal despite care. These lesions, which can often be ignored or attributed to minor trauma, bites, or superficial infections, could be the first clue that something more serious is happening at the cellular level. One of the reasons why this sign may go unnoticed is its location. Suspicious lesions or wounds may appear in areas of the body that are difficult to visualize, such as the back, scalp, or even between the toes. In addition, the odor, if mild at first, could be attributed to hygiene problems, common bacterial infections in wounds, or even the use of certain cosmetic products or dressings. It is crucial to understand that a persistent and unpleasant odor emanating from a wound on the skin should not be ignored. Faced with this sign, the recommendation is to seek the evaluation of a dermatologist as soon as possible. A detailed physical examination of the skin, along with a biopsy of the suspicious lesion for histopathological analysis, are fundamental to confirm or rule out the presence of skin cancer. Even if the odor seems mild or insignificant, it could be an indication of an underlying problem that requires immediate medical attention. Early detection of melanoma and other types of skin cancer is vital for successful treatment and to improve the patient's prognosis. 6. An alarm in the urine, the smell of ammonia, coming from the kidneys. Kidney cancer is a serious disease that often develops silently without presenting evident symptoms in its early stages. However, our body sometimes provides us with unusual clues that could alert us to an underlying problem. One of these clues is a change in the odor of urine. A strong and pungent odor that resembles ammonia may be one of the first warning signs that something is not working properly in the kidneys. This characteristic odor is produced when the kidneys, whose main function is to filter the blood and eliminate waste products and toxins from the body through urine, begin to fail due to the presence of cancer. The alteration in renal function can lead to an accumulation of certain chemical byproducts in the body, such as urea, which when decomposed releases ammonia, generating the distinctive odor in the urine. It is important to note that not all ammonia odor in urine is indicative of kidney cancer. Other medical conditions, such as urinary tract infections, UTIs, severe dehydration, or even diets very rich in protein, can also cause an alteration in the odor of urine. However, if this ammonia odor is persistent and is accompanied by other symptoms that suggest a kidney problem, it is essential to investigate the underlying cause. The symptoms that are frequently associated with kidney cancer include pain in the lower back or side, the presence of blood in the urine, hematuria, intense and persistent fatigue without an apparent cause, and unexplained weight loss. The combination of these signs with a strong ammonia odor in the urine should not be ignored and requires timely medical evaluation. An additional problem is that many people may hesitate to seek medical help for a change in the odor of urine, believing that it is not a serious symptom. However, kidney cancer is generally more treatable and has a better prognosis when diagnosed in its early stages. Therefore, paying attention to the modifications in the odor of your urine and any other associated symptom can make a big difference in the outcome of treatment. If you notice this ammonia odor along with other worrying symptoms, or if it appears Inexplicably, schedule a medical appointment immediately for a complete evaluation of your renal function. 7. Metal in the air, a sign of danger in the blood. The metallic odor is another unexpected sign that, although subtle, could be associated with a serious disease, cancer in the blood, such as leukemia or lymphoma. Some people affected by these hematological neoplasms report perceiving an odor that they describe as metallic, similar to oxidized iron or old coins, either in their breath or in their sweat. Where does this unusual odor come from? It is believed to be caused by the alterations in the levels of iron and other chemical compounds that occur in the blood when cancerous cells interfere with the production or destruction of normal blood cells. In leukemia, for example, there is an uncontrolled proliferation of abnormal white blood cells that displace healthy blood cells. This alteration in the cellular balance can release certain metabolites or compounds that contain iron, which could evaporate and be perceived through the breath or skin, especially in situations of sweating or after physical activity, even if it is mild. The biggest challenge with this sign is that, being subjective and not causing immediate physical discomfort, it is often ignored or attributed to external factors. Most people might associate a metallic odor in the environment with changes in air quality, diet, certain supplements or foods rich in iron, or even personal hygiene products. However, when this odor becomes persistent and has no evident explanation, it could be a sign that something more serious is happening internally. It is crucial to consider this metallic odor in the context of other symptoms that usually accompany leukemia and lymphoma. These include extreme and persistent fatigue that does not improve with rest, fever or night sweats without a clear cause, recurrent infections that take time to heal, inflammation of the lymph nodes, lumps in the neck, armpits or groin, easy bruising or bleeding, and unexplained weight loss. If the metallic odor in the breath or sweat is present along with any of these symptoms, the need to seek medical attention becomes a priority. A complete blood count can reveal abnormalities in cell counts and provide important clues for diagnosis. Early detection of blood cancers is essential to start appropriate treatment and improve the chances of remission. 8. Sweet smells that nobody wants to feel. The odor of lung cancer. Lung cancer is one of the most silent and dangerous forms of the disease, as it can develop without presenting visible symptoms for a considerable time. However, in some cases, there may be an unexpected sign that manifests through the sense of smell, a particular odor in the breath. Some people with lung cancer have reported perceiving a sweet and slightly fruity odor in their breathing. This odor is believed to be caused by the release of volatile organic compounds, VOCs, in the lungs. These compounds are byproducts of the altered metabolism of cancerous cells. As tumor cells grow and multiply, their metabolism differs from that of healthy lung cells, generating different types of VOCs that can accumulate in exhaled air and be detected by the sense of smell. Although this sweet odor may resemble that of fermented or slightly overripe fruit, it is important to distinguish it from common bad breath. It does not disappear easily with oral hygiene and, above all, tends to be persistent. Unfortunately, this olfactory sign can go unnoticed for months, as it is easily confused with other less serious conditions such as digestive problems, reflux that could give a slightly sweet breath, or even with diet or inadequate oral hygiene. In some cases, it could be erroneously associated with metabolic problems such as diabetes, which in certain situations can alter the odor of the breath, although generally more ketonic or fruity. For this reason, it is essential to pay special attention if a sweet odor is perceived in the breath frequently and without an apparent cause. This sign, although subtle, could be an indication of metabolic changes at the pulmonary level that deserve a more in-depth investigation, especially if it is accompanied by other common symptoms of lung cancer, such as persistent cough, which may be dry or with expectoration, sometimes with blood, chest pain that worsens when breathing deeply, hoarseness, difficulty breathing, dyspnea, wheezing, recurrent respiratory infections, bronchitis, pneumonia, and unexplained weight loss. If you or someone close to you experiences this sweet odor in the breath persistently and without an obvious reason, it is essential to seek the opinion of a doctor. Diagnostic tests for lung cancer may include chest X-rays, computed tomography, CT scans of the chest, bronchoscopies, examination of the airways with a camera, and biopsies of lung tissue for analysis. Early detection of lung cancer, especially in smokers or people with risk factors, is crucial to improve survival rates. We hope this detailed information has been very useful to you. Remember that early detection is the best tool in the fight against cancer. If you have found these explanations helpful, do not forget to like this video, share it with other people who may benefit from this information, and subscribe to our channel to receive more health tips and information that can save lives. Together, we can raise awareness and help more people take control of their health. Stay informed, stay healthy, and we'll see you in the next video.